Hey everyone, this is Dr. Andy Tao here at Austin Gastroenterology. It's my privilege today to discuss with you a recent paper that I wrote and published in GIE. This paper is entitled Topical, Hemostatic, Preventative, and Therapeutic Agents, Clinical Impact and Utility. I'd like to discuss with you why I wrote this paper, some of the contents of the paper, and maybe some future directions with respect to hemostatic topical agents. This discussion will happen in a semi-self-conducted interview fashion. Thanks so much. Why did I write this paper? I wrote this paper as a sort of Yelp review for hemostatic topical agents. Unlike clips, which generally have a very similar look and feel to them, topical hemostatic agents are very different. They're different in their indications, their mechanism of action, their technical features, as well as their cost. So I wrote this paper for the gastroenterologist who may not be performing hemostasis on a daily basis, or even for the gastroenterologist who does, but may only be exposed to one or two of these agents. This paper should serve as a one-stop shop to compare and contrast these agents such that one can make an informed decision about which fits their practice and their patients best. I'd like to briefly show you these agents. Some of them are very familiar to y'all. This is Hemospray. Everyone recognizes this. This is the precedent or original product. You simply activate the CO2, turn on this stopcock, and then you have to prepare the scope for passage down the channel. It does not have continuous airflow to protect the catheter tip, so the instrument channel has to be flushed and nice and dry, and you cannot get the catheter tip wet. And like many of the other agents, you cannot suction while you do all that catheter passage. And then, of course, when you spray using this button, oftentimes there's a kind of cloudy storm effect and the visualization is not as good. However, if you notice, look at this baby. It provides 20 grams of powder, and the most the other competitor provides is 5 grams with Endoclot. So it provides almost a virtual unlimited amount of ammunition. And that's very important when it comes to refractory bleeding, specifically, in my opinion, arterial bleeding. The next agent is Next powder. It has a similar kind of gun-like mount. The powder is here, and you can notice it's significantly less. It only contains 3 grams. But one of my favorite things about this gun is that it has a lever that allows you to adjust the amount or the powder that you're delivering over time. It is also more difficult to clog, but it can still clog than Hemospray because it is propelled by a continuous flow of room air, which you can turn on with this button. If you notice, it's kind of loud. And so that can kind of be a negative, and you really need to talk loudly during the deployment of the device. If you run out of the powder, you'd have to open up an entirely new kit, which includes the gun and everything else, and then kind of reinstall. There are no kind of ammunition packs, if you will, to refill it. This is Endoclot. It is the third topical hemostatic powder. It does not have a gun housing or a trigger. Instead, it comes with this simple bellow that contains the agent. It also has a catheter that's attached to it. And then the other attachment is a tubing to the air compressor. So this device is not all in one packaged like Hemospray or Next powder. There's an air compressor, and then there's this kit component. Now, unlike the other agents, there's no kind of button to press. Instead, the technician has to gently turn and tap the powder out in a bespoke fashion to match what the endoscopist wants to deliver. And so for that reason, there's a little bit of a higher learning curve. Now, just like Endoclot, it is propelled by room air, and it has a continuous protective propulsion of room air that comes from the air compressor. If you're doing a travel case in the ICU, you need to remember not to forget the air compressor, and because it doesn't all come together as one kit. Lastly, we have the final Purastat. This is a topical hemostatic gel, not a powder. It's simply loaded onto a adapter and then a catheter. Interestingly, the adapter and the catheter are sold by a different company, so you have to purchase them kind of piecemeal. Purastat is a very nice agent because, as you can see, it's completely transparent. And this allows one to use it intraoperatively in the middle of, say, a resection, like an EMR or an ESD, and still preserve the visual field, because you can actually see through this even if the scope is submerged within it. And so that is a very unique feature. The other thing about Purastat that's important to note is that it essentially doesn't clog, and it's just propelled by squeezing a little bit of an air-filled syringe, and it delivers very, very easily. I think the barrier to entry for this is much lower than the others. However, the indication for this is only for oozing type bleeding and not for arterial level bleeding. Lastly, there's a special indication for this, which the other topical powders do not have, which is for the prophylaxis of bleeding after endoscopic resection. To conclude, I think all of these topical agents are extremely valuable in the armamentarium of endoscopic hemostasis. They do have some unique differences, specifically in their technical features and their deployment mechanisms. In terms of their efficacy, evidence is significantly lacking for all but Hemospray, and one of the future directions for research is to determine whether or not these agents are truly all equal. Because unlike clips, who all share the same general tissue apposition mechanism, these agents are fundamentally different chemicals, and whether or not we can translate the efficacy of one towards all the others remains to be proven. Another line of research is in peptic ulcer disease with adherent clots, and whether or not these topical agents, specifically the gel or the gel-like ones, can stabilize these blood clots and potentially forego the need to dislodge them, say, in the middle of the night. Thanks so much.